It's good when something warms your heart. It's bad when something makes your heart burn. Indigestion is often acid reflux. And here to reflect on reflux is the top doc, not the second or third, the top doc for this topic, Dr. Ronnie Fass from Metro Health. Thanks for joining us today.
Thank you for having me.
So you really are the top doc in the world. You've been described by that by Expertscape. That's fabulous. Congratulations.
Thank you very much.
The Director of Gastroenterology and Hepatology and the head of the Esophageal Center at Metro Health. And you've set up an advanced swallowing center. So I guess the place to start is, what is GERD?
So the word GERD stands for gastroesophageal reflux disease. Now, many of us experience heartburn from time to time, but this is not gastroesophageal reflux disease.
All right, so when how do you know? I mean, tell me about the symptoms and how do we know what we have?
Gastroesophageal reflux disease, and the emphasis is on the word disease, is when you have a dysfunction of the sphincter between the esophagus and the stomach. And this is a type of muscle that prevents from food coming back into our esophagus and also from acid coming back into the esophagus, which is gastroesophageal reflux. When you develop symptoms like heartburn, you develop symptoms like feeling food that is getting stuck in your esophagus, symptoms that are getting worse when you're in the upright position, worse at night in particular, relieved by antacids, and if you have nausea after eating, all of those constitute gastroesophageal reflux disease.
All right, so these symptoms you've just described, they clearly make you uncomfortable. Are they actually dangerous to our health?
In general, they affect our quality of life and they do affect our daily living. But in some patients, they may cause inflammation, they may result in narrowing of the lower part of the esophagus, and then in about 6 to 12% of the patients with heartburn, their normal esophageal lining is replaced by stomach lining. This is what we call Barrett's esophagus. And if you have Barrett's esophagus, it puts you at risk of developing cancer of the esophagus, which is the fastest rising cancer right now in the United States.
So what can we do to prevent GERD from occurring in the very first place?
Well, the low-hanging fruit, of course, is lifestyle changes like avoid alcohol, avoid caffeinated foods and drinks, decaffeinated coffee, high-acid fruits, vegetables, spearmint, peppermint, as well as others.
Okay, and then you've got a list of life changes as well.
Yeah, eat smaller meals, lose weight if necessary, quit smoking, do exercise, reduce stress in your life, and even avoid clothes that are tight. That's probably what we call easy to do.
Yeah, okay, but now let's say you got the GERD and we want to treat it. What can we do to treat it?
We talked about the lifestyle changes,
right,
and these are something that you can do. Other things, you can use antacids if you have heartburn, and we have over-the-counter medication or prescription medications, and in some patients, we can even offer surgery.
At what stage do you go see a doctor about it rather than just pop an antacid?
If you start to have repeated symptoms on a regular basis, if your symptoms are associated with something like problem swallowing food, all of those are indications to come and see a physician and get some more exploration of your problem.
Thank you very much, doctor. Appreciate that very much.
Thank you for having me.
It's absurd to not try to stop your GERD. Follow Dr. Fass' advice to minimize GERD or even to keep it from occurring in the first place. And if you need more help, use the information that's coming up next. My thanks to the world's best, Dr. Fass, for stopping by our part of the world today.
Find out more by calling Metro Health at 216-778-7800 or visit www.metrohealth.org. Want more Metro Health medical information? Be sure to tune in to WTAM 1100 each Saturday morning at 7 for Metro Health and You, hosted by Dr. Christine Alexander. Next, don't lose out on Social Security benefits even after a divorce.